Hello everyone, I am Casey Amaratombo, your student nurse from Davao Doctors College, and for today's video, I am going to perform the parenteral drug administration return demonstration. So, parenteral drug administration refers to any methods of administration other than the oral means. However, it is the most common associated with injecting this straight into the body by passing the skin and the mucous membranes. The most common routes for the parenteral administrations includes the intradermal, subcutaneous, intramuscular, and the intravenous route. Now, in performing the medication administration, it is the important to remember to observe and perform the 10 rights of medication and administration to ensure the patient's safety, and thus we give our clients the most appropriate care. Now, for this video, I am going to perform the three skills which will be divided into the three scenarios. So the first scenario will be includes the medications administration through the intradermal route. The second scenario will be includes the medication administration through the subcutaneous route. And the third scenario will include the medication administration through the intramuscular route. So now these three scenarios have the same preparation phase, and so I am going to perform it at once to avoid making this video unnecessarily long. So now I am going to begin. So before we actually proceed with the actual administration of the medication to the patients, the first thing we have to do is to check the doctor's order or the medication administration's record. So this is done. That will be able to identify what drug will be given by assignments patients. So we have to determine the drug name, the dosage, the route of the administrations, in the time it is to be given. And now after doing that, we have also to check the label of the medication against the medication administration's records, to ensure that we prepare the right medication. Now, in medication administration, it is important to perform the three checks. So, first is we have to check or read the label of the medication when they're taken from the medication's card. So, the second, we'll have to read the label again before withdrawing the medication. And third, we'll have to read it again after withdrawing the medication. And after doing that, we'll have to proceed with the preparation of the equipments needed to conserve time and energy. The equipment includes the syringes. I have this in the tuberculin syringe, and I have the insulin syringe in the 5cc gauge and 23 syringe, and also have the aspirating needle. And I have my hypodermic tray and the forza. And I have my alcohol and the sterile water with the served medications of the demonstrations. So, and I have the cotton ball soap with the 70% of alcohols, and have the waste receptacles here, and I am going to proceed now with the preparations of the medication. Before I do that, I am going to perform the hand hygiene to observe the appropriate infections, preventions, and procedure. So if the medication still needs to be reconstituted, then the vial would contain the powdered form of the medications, and diluent must be added into that vial. And after adding the diluent, we must mix it thoroughly by rubbing the vial in between the palm of both our hands. Now, after doing that, I'm going to prepare the syringes. I have here the tuberculin syringe, and the ideal for the skin testing and intradermal injections. So now I'm going to open the pocket. It is important to remember that we can only thought the barrel and the plunger of 9F the syringes to avoid contaminating the needle. Now I'm going to open the aspirating needle and then connect the barrel into the aspirating needle to ensure that the connection isn't loose. And now I'm going to set aside it first. And I'm going to open the covering of the vial. And then the rubber cell is exposed, and I'm going to clean it up using the cotton balls in the 70% alcohol. Now after doing that, I'm going to get my syringe first and uncap the syringe. And then I'm going to draw air into the syringe, and the amount of air will be equal to the amount of the medication that needs to be administered. And then I'm going to push the air into the vial. So pushing air into the vial will prevent the vacuum from forming, and if you put too little air, then you will find it hard to draw out the medication. And if you put much air, when the medication might be forced out of the syringe. So now I'm going to invert the syringe. And draw the exact amount of the medications needed. And after doing that, if you see the air bubbles inside the syringe, then we can slightly tap the barrel and expel the air bubble. And then I'm going to remove this aspirating needle. Then throw it to the waste receptacle to avoid the needle's break injury. Now I'm going to connect this barrel now to the appropriate size needle. Okay, so now I'm going to place the syringes with the medication into the hypodermic tray. And I am going to write the medication ticket so that we won't forget that medication is the dosage and for who is assigned to. Now I am going to do the intradermal medication administration. So intradermal medication administration, introduction of the small amount of the solution into the dermis of the layers beneath the epidermis. So hello ma'am, good day. My name is Kisa Marlatomba, your student nurse from Davao Doctors College. So my series ban ma'am. Can you please state your complete name and your birthday please? Okay, so ma'am, what do you want me to call you? Okay, ma'am Jess. So ma'am Jess, today we'll be doing a penicillin skin test. So what I am going to do is to inject a small amount of the penicillin into the for your arm in the skin if your forearms to check if you are allergic to the medication or not. So will that be okay? Okay, so before we begin, ma'am, I'm just gonna close the curtains so no one from outside will disturb us. Now we'll have to select the site for injection. It should be 3 to 4 finger width below the antecubital space and 1 hand above the wrist. We should avoid using the site that are inflamed, tender, swelling, and has lesions. You also have to apply clean gloves. After applying a clean gloves, we'll have to clean the selecting site of injection using a cotton ball soaked in the 70% alcohol. And then start in a circular motion, starting from the center going outward. After doing that, we are going to get a syringe and prepare it for injection. So we'll have to remove the cap of the syringe, and if there are air bubbles present, and we can tap the barrel to remove the trapped air bubbles. And then we should hold the syringe between our thumbs and 4 fingers, and then hold it almost parallel to the skin surface with the bevel needle up. We should have to stretch the skin tongue. Now I'm going to advance the needle into the patient skin. And then push the medication scene until slowly until well form the appearance of the will indicates the medication has entered the area between the interdermal tissues and the medication has been correctly placed in the dermis. And now we'll have to withdraw the needles into the same angle with inserted to minimize patient's discomfort and minimize damage to the tissues. Now we're going to discard the needle into the waste receptacles. And then we're going to draw a circle around the wheel. We should also use a blue or black pen because a red pen will interfere with the reading. Okay, ma'am, I'm done. So are you feeling alright? Okay, ma'am. So we will wait the result after at least 30 minutes. So I'm gonna head out first so that you can hear, you can have some rest here while waiting. Okay. Okay, ma'am. So just ensure not to massage the area of your injection and do not erase the mark that I placed around it. Okay. Okay, so if you you need anything, do not hesitate to call or to use the call button so that I can back here and attend your needs. Okay, so after doing the procedure, discard the gloves. You discard the gloves. And perform the aftercare of the equipment and also proceed to the documentation process of the procedure. And after 30 minutes, ensure that they come back to the patient's room to interpret the result of the skin test. So now I am going to perform the subcutaneous medication administration. So the subcutaneous administration is the introduction of the small amount of the solution into the adipose tissue beneath the skin by the means of the syringe and the needle. So after preparing the medication, heads over the patient's room, introduce yourself to the patients, verify the patient's identity, explain the procedures to the patients, and ensure the patient's privacy as well. So good day, ma'am. My name is Kisa Merlatamba, your student nurse from Davao Doctors College. So may I see your wristband, ma'am? Okay, so please state your complete name and your birthday, please. Okay, ma'am. So what do you want me to call you? Okay, ma'am Jazz. So today, ma'am, I will be doing the administration of your insulin. So insulin will help your bodies control your blood sugar as you have type 1 diabetic, or I'll be injecting your insulin in the subcutaneous layer of your skin over your abdomen. So will that be okay? Okay, ma'am. So I just close the door so no one from outside will disturb us. Okay. Now for the subcutaneous injection, we still have to select the site that is free of lesion, free of tenderness, swelling, or lesion, and then we'll have to apply the clean gloves. After doing that, we are going to clean the selected side. I'm using an antiseptic swab starting from the center going outwards. And then we're going to prepare a syringe for the injection. So uncap the syringe, pinch the skin, hold the syringe as if you are holding a dart, and then inject the medication into the patient. So we are going to inject the needle at the 45-degree angle. Now I'm going to release the pinch skin and then support the syringe and then pull and push the medication in, and after doing that, I'm going to remove the needle the same angle it was inserted. Now, if bleeding occurs, apply the pressure to the site with a dry sterile gauze until it stops, and then we have to dispose the used syringe into our waste receptacle. Okay, ma'am, we're done. So, how are you feeling right now? Okay, good. So, since we're done, I am going to head up now so that you can have some rest. Okay, so if you have need anything, use your call button so that I can um, look back here and attend your needs. So after doing the procedures, discard the gloves you use and perform the care of the equipment and proceed to the documentation of the procedures done. So now I am going to the intramuscular medication administration. So the intramuscular administration is the introductions of the medication deep into the muscles tissue where there is a large networks of the blood vessels that can absorb the medication readily and quickly. So after preparing the medication, head the patient's room and introduce yourself to the patients and verify the patient's identity and explain the procedure to the patient and also ensure the patient's privacy. Hello ma'am, good day. My name is Kisa Marlatombo, your student nurse from Davao Doctors College. And may I see your wristband, ma'am? Okay ma'am, so please state your complete name and your birthday please. And what do you want me to call you? Okay, Ma'am Joss. So, Ma'am Joss, I'll be administering you the medication that has been prescribed by your doctor. So, it's a drug name is cortisone. It is an anti-inflammatory which will be infecting this medication of your shoulder. So, will that be okay? Okay, ma'am. So, I close the curtains so that no one can disturb us during the procedures. Now, for the intramuscular injection, we have to select the site is free of lesion, free of inflammation, swelling, and tenderness, and then apply the clean gloves. After doing that, we'll have to clean the sites of the injection using the antiseptic swab, starting from the center, going outwards, and then discard the used antiseptic swab. After doing that, we are going to prepare for the injection. So we are going to get our syringe and uncut the syringe, holding the syringe using our dominant hands as if holding a dart, and then using the C-track methods, we are going to advance the needle into the patient's skin. So we are going to advance the needle at the 90-degree angle. After doing that, we are going to aspirate, see if there is a blood that will appear on the plunger. If there is, we are going to remove the needle and discard the syringe and get a new. If there is no blood, then we can insert or we can administer the medication steadily and slowly. Now we are going to remove the needle from the patient's body and the same angle it was inserted, then apply pressure to the injection site, then discard the syringe into the waste receptacles to avoid needle prick injury. Okay ma'am, so we're done with your intramuscular injection. So how are you feeling right now? Okay, are you feeling alright? Okay, ma'am. So that's good. So since we're done, I'm gonna let you have some rest now. So I'm gonna head out. So if you have need anything, just use the call button so that I'll be noticed from the nurses stations and come back here and attend your needs. Okay, ma'am. Thank you. So after doing the procedure, discards the gloves used. And perform the aftercare of the equipments and proceed to the documentations process of the procedures done.